Hot Springs Village Inside Out is a closer look at the greatness of Hot Springs Village, Arkansas and the surrounding areas. People, places, experiences. Hot Springs Village is one of the most beautiful places on earth. Join me, Randy Cantrell, and my co-host Dennis Simpson as we engage in weekly conversations to explore Hot Springs Village Inside Out. Today's show is brought to you by Central Arkansas's favorite radio station, KVRE. Find them on the dial at 92.9 FM. Stream them live at kvre.com. RE/MAX of Hot Springs Village. The award-winning RE/MAX of Hot Springs Village is the largest real estate office inside the village with over 30 full-time agents and support staff. Visit them to learn more about this beautiful place to solve your real estate needs. Call them today at 1-800-364-9007. Find them online at explorehsv.com. They are RE/MAX of Hot Springs Village at 1-800-364-9007 or online at explorehsv.com. Ike Eisenhower State Farm. Ike and his award-winning team have been serving the insurance needs of folks all around Hot Springs Village since 1998. Ike has qualified for State Farm's President's Club, Chairman's Circle, and Hot Springs Village Insurance Agent of the Year. Call Ike Eisenhower State Farm today at 501-984-4100. That's 501-984-4100. Find them online at ikeeisenhower.net. Call them today for all your insurance needs because, like a good neighbor, Ike Eisenhower State Farm is there.
Hot Springs Dinner. Okay, it's only been 200 shows since I've made a mistake like that. Hot Springs Village Inside Out. I'm your host, Dennis Simpson. These lovely ladies are
Laverne Clements and Phyllis Donnelly.
And it's great to have you today. And y'all are with SHIP, S-H-I-P-P. Now, I'm not very good at spelling, but I do know that's not usually how SHIP is spelled. But tell me what that stands for.
So it's SHIIP, which is Senior Health Insurance Information Program.
And so I see Joe Namath. I see people. I see advertisers on TV all the time, and they're trying to sell healthcare, and they're trying to sell Medicaid, and they're trying to sell Medicaid. It is so confusing. What exactly does Arkansas SHIP do?
So the Arkansas Senior Health Insurance Information Program is a federally funded program, and what makes us different from other agencies is that we offer free, unbiased, confidential Medicare information and counseling, and we do not profit from the information that we share to Medicare individuals. We are here to help assist Medicare individuals make the best healthcare choices for themselves.
So, and let me understand this a little bit more. You've got a 1-800 number. I would call that 1-800 number, and you sell me something or no?
No, we do not sell anything.
Okay.
When an individual calls the Medicare office, we'll get some demographic information, which is their name, telephone number, and the county that the individual lives in. And from that information, based upon the zip code and the area that they live in, we have other trusted partner offices throughout the state of Arkansas. So based on the county, again, then we would route you to one of our Medicare SHIP partner offices.
So let me get this straight. So I'm in Hot Springs, or a Hot Springs Village area. There's Garland County, there's Saline. Does it matter what county I live in? Is there an agent per county?
Yes, it's not an agent per county, but we will route you to the nearest SHIP partner office. So for instance, Garland County, we have a partner office called Caring for Arkansas. So in Garland County, we route you over to our Medicare partner office.
So roughly, when I call Caring for, what was it again?
Caring for Arkansas.
Caring for Arkansas. When I call them, because that's the area I'm living in, they're going to give me a list of providers, or they're going to give me a list of options. How do we do that?
For instance, if a Medicare individual is new to Medicare and they're wanting to know their Medicare choices, the certified Medicare counselor would explain to the Medicare the benefits of Medicare, how to get started with enrolling in a Part D plan for their prescription medications, or if they're interested in Advantage plans, the Medicare counselor would talk to them about their other options, which is the Medicare Advantage plans.
Now, I heard you say, and I don't mean this derogatorily in any way, but I heard you say a qualified counselor. I mean, I've heard people talk about calling these 1-800 numbers for all over from the television advertises, and you hear 500 people in the background, and then this is going to be information just for me, right?
Just for you.
Well, I didn't think, and I've worked with Mr. Carroll before, who I think the world of, but we've worked on this before. And some of the other shows we've done, we talked about how to kind of wade through this. I am a pristine 60 years old. I just turned 60. So I know, I look good except for the hair. I know. And quit it. Stop. But all that said, about the time you turn 65, the phone lights up, doesn't it, ladies?
Yes.
It does.
And what's is this the easiest way to navigate? Is just call AR Ship?
To me, the best way to navigate would be to call AR Ship, because if you're talking to someone on the phone, they're going to be trying to sell you their products or endorse their products. But here at Ship, we give you unbiased information, about your specific case for you to make an informed decision about what Medicare plan or which way with Medicare you want to actually go.
Well, so, and I realize that Medicare is a government program, Medicaid, and I understand that those are provided for us. Who pays for SHIP? Now, and well, what I do know, SHIP is a nationwide governmental program. Is that correct?
Yes, that's correct. And again, it's a federally funded program. We're funded by the federal government, and there is a SHIP office in all 50 states. Anywhere in the U.S., there is a SHIP office.
So this governmental program is basically set up to help people navigate Medicare and Medicaid. Is that correct?
Yes, that's correct.
I thought this sounded kind of silly until I understood what the donut hole was. And then I thought it sounded like a really, really good idea right after that. Because, well, explain, for example, what is the donut hole? What does that do?
What the donut hole is, when you're on a Part D for your Medicare prescription medications, it's what you and your plan pays for your Medicare prescription drugs. Once you and your plan has reached a certain amount, I think it's like it's a little bit over $4,000. You go into what we call the donut hole, and your medication, your copays go up a little bit more when you're in the donut hole. So some people can reach the donut hole in January or February of the year, depending on what prescription medications that they're on.
So basically it's a dropout or a reduction in coverage, and then if you use a lot more, does it come back up?
Does it come back up?
No. For example, I get to $4,000 and my compensation or my reimbursement goes down a little, and I have more out of pocket. Is that correct?
That's correct. So once an individual goes into the donut hole, or it's called now the coverage gap, then individuals will go into what they call the catastrophic period. And once they go into the catastrophic period, that's when the medications will cost a little bit less. So you have the donut hole, then the catastrophic hole.
And you ladies are proving my point perfectly. You'd simply need to call arship.com. What is that number? I didn't see the number on the website. Did I miss it?
Yes, the 1-800 number for SHIP is 1-800-224-6330.
Okay, 1-800-224-6360. Okay, we've got it right down here in the bottom corner.
330.
I'm sorry, 6330. And so a governmental program ran locally in each state has counselors or resources that you can contact in each area. There's no portion of Arkansas that's not covered?
No, there's no portion of Arkansas that's not covered. We have trusted Medicare SHIP partners throughout the state of Arkansas. And of course, if we can't get your representative in your area, you can always call our main office here, which we're located in Little Rock.
And you're right. I misspoke earlier. I had two P's and it's two I's, right? It's ARSHIIP.
Correct.
We clearly need a better presenter. No question, we need a better presenter. Well, I really, I know this is kind of a shorter episode, but is there anything we've missed? I just want to make sure that the principle, recap it real quick. This is a governmental agency. It's zero cost out of pocket. It's not designed to get money out of your pocket in any way. It's actually a governmental organization or agency trying to help you navigate Medicare and Medicaid. Is that correct?
That's correct. And it's absolutely free.
Absolutely free. And I had a friend, the gentleman who has the podcast here with us, who is old. I mean, he's like 65 in 3 months or something, and he was going through this process and saying, oh, geez, the phone never stops ringing, and the email and the mail in the mailbox never stops. And he said, I always heard people say how difficult it was to kind of navigate the waters and see what's best for you until I got there. And it can be very difficult. Is that correct?
That is correct. And again, that's why our office exists. And one of the reasons that Medicare individuals' phones start ringing, they get plenty of mail, is because Medicare individuals have an initial period to enroll in their Medicare benefits. And that is a 7-month window. And that window is 3 months before the individual turns 65. The birth month of the Medicare individual, and then they have 3 months after the individual turns 65. So there is a 7-month initial enrollment period to enroll in your Medicare benefits.
Excellent point. And let me make sure. So I'm a July baby. Okay. So in May or April, I would start getting mail, right? And then I would have till roughly October to make a decision. What if I don't make a decision? What if I'd go, this doesn't apply to me and whatever? What happens?
If Medicare individuals continue to work, they don't have to worry about the window. But for individuals who decide that they're not going to work, they're going to retire, that initial enrollment period is very important, because if individuals miss their initial enrollment period, of course, they'll have another option to enroll in their Medicare benefits, which we call the general enrollment period. But if an individual just does not enroll in their Medicare benefits, they may face a penalty for not enrolling in their benefits at the time that they're eligible. Yes, that penalty never goes away.
I figured there would be a catch in there somewhere. I figured there would. And there's always people that, for whatever reason, are late or, incapacitated or whatever. So basically what you're telling me is that if I'm not inside the enrollment period, don't get sick. Is what I heard. Is that right? Right? Unless
you have other coverage. Some individuals might have coverage through a spouse or something, but if you don't have any other coverage, don't get sick.
Yeah, I got to get me one of those rich wives. I've been thinking about that. How do they? Richwives.com. There are things you probably don't want to have your wife find on your browser history. You just don't want to go there. You know what I mean? And for those that know me, I would never, I am joking. She's an exceptional woman. My point being, it's so much to learn. You have to learn how to be older, right? How to go through the retirement age. And it's a free tool that helps explain that and navigate that water for you. I think this is navigate. Frankly, there's a couple of areas, and I'll be very frank about this. There's a couple of areas that I think the federal government does an exceptional job. Number one, I love national forest and parks. I think setting aside national land is exceptional. And I tell you what, as many people as may throw a stone at Medicare or Medicaid, people love it. It really is a lifesaver for people, because as you get older, that medical expense can, wipe out your entire savings, right?
Yes, that's true.
Well, ladies, it's been a pleasure. Thank you for joining us. Would you come back sometime if I didn't scare the skin off of you this time?
Yes, absolutely. And thank you for having us.
Oh, it's a pleasure. It's a pleasure. I tell you what, let's just, for what it's worth, we've kind of skimmed over the top part. We've kind of talked about all that. As general enrollment gets a little quicker, let's come back around and have another discussion, okay?
Yes.
Ladies, it's been a pleasure. For Hot Springs Village Inside Out, I'm Dennis Simpson. We will see you next time.
Thanks for watching and listening to Hot Springs Village Inside Out, a weekly podcast starring Hot Springs Village, Arkansas. Visit the website at hotspringsvillageinsideout.com.